everyone. Welcome to Service World Podcast, a podcast where we educate, equip you, and teach you life basic things that you can use to save your life and the life of your neighbors. Today, we are not going to be talking much about health matters, but rather a psychological issue that has to do with clinical experiences that nursing students face. So to get a full gist on this, I'm here with two distinguished guests who will be telling us more about it. So I will allow them to introduce themselves.
Okay, my name is Okechukwu Monica. I'm a student nurse.
Okay, my name is Dennis Goodness and I'm Nachi. I'm a student.
So I'm glad to have you in my studio today. So without wasting much of our time, we will be talking about this clinical experience in detail. So I want to know, as a student nurse that got admitted into a nursing school, and when you heard about this issue of clinical posting, what did you feel like?
Okay, when I got admitted into nursing school and I've been hearing about clinical posting, first of all, I thought that it was going to be so exciting and to be somehow like a mixture of all the things that we have been learning in the textbooks, but it was kind of different when I went for mine.
Wow, that's been so nice. Goodness, can we also hear from you? What was the experience like?
Okay, thank you so much. For me, I thought of it as another part of learning where we got based on practicals and experience. That's just it.
So thank you for that experience. In fact, me too, when I heard about it, I felt the same way too. So I want to know, Nurse Monica, how did you feel like the first day you entered the hospital setting, not as a regular patient or a regular person, but as a student nurse? How did you feel like?
Okay, thank you. The first time I went to the hospital setting, when I went to the hospital setting, I was a bit excited, but I was nervous at some point because I saw new faces that I don't know. Even the matrons there, they were harsh. The environment there was so new to me, like I could not even adapt to it. But within some space of time, I had to adjust my life with the hospital life.
So that simply means that despite how hard it was for you at that first time, you still managed to cope up.
Yes.
Wow, that's good. So, Nurse Goodness, I would like to know, what shocked you the first time you entered into the hospital setting?
Okay, thank you. That was when I worked in the female medical ward at Absolute. Sorry, that was my first clinical posting. Okay, I met a patient with pressure sore. But before then, we were taught about pressure sore being a medical condition whereby a patient or an individual is lying on a particular position for a very long time and there is lack of blood flow on that area. So when I got to that ward, I saw a patient with pressure sore. They didn't really tell me that it was a pressure sore, but I saw wounds, lots of skin and then tissue damaged. So I tried to ask the staffs there what caused or what led to this condition. He told me it was pressure sore. So I was a bit shocked because compared to what we are told about pressure sore, it was not what I expected and what I saw. So I was in a bit of shock.
Wow. So having heard about your experience, about this shocking experience you had about this pressure sore, I want to know, is there anything that you witnessed at a posting that no one actually told you about it? You didn't get any false information about it? Do you have any experience like that?
Okay, yes, about time management. I'm not actually someone that meets up with time. So, no one told me that the matron would truly scold at me for coming late. So, no one told me about it. Yeah.
So having heard what Nurse Goodness said, I want to know what you were taught in the class. I mean, the theoretical part of it. Did it actually covers what you had experienced in at the clinical posting?
So the theoretical aspects didn't like prepare me so much for the practical aspects of which I went through in the hospital. The theoretical aspect, it was nice, it was amazing, but the practical aspect was the shocking part of it, because most of the things that I saw in the textbook like didn't apply to the practical aspects there in the hospital, because there were a lot of things that I learned in the hospital that I didn't see in my textbook. For example, how to work hand in glove, with the staff there, and also with your colleagues.
So I want to know, Nurse Monica, during your experience, was there at any point in time that you felt like giving up? Maybe like I'm tired of this something, or in nursing, in this clinical experience, emotions play a vital role. I believe one way or the other you might have been facing something that made you want to give up. If actually you felt something like that, can you tell us what triggered it?
Okay, yes, I felt like this nursing is not for me. I really wanted to give up. The thing that caused it was the staff nurse shouted at me at some point. I felt like, can I do this thing? I cannot receive all this kind of insults from this type of people, that they are very harsh, very rude, and they are not understanding. So I wanted to quit nursing at that point, but I remembered some certain things that had to push me up.
So that means that you understood that nursing is not just a profession, but a vocation. Yeah. So it's not something that you have to quit. As long as you're a nurse, you have to face challenges, because matrons can challenge you a lot. So thank you for that. At least you are back. I believe you are not gonna quit again. Thank you so much. So Nurse Goodness, I want to ask you a question, and that question is very, very simple. Like, I want to know, at your clinical experience time, what actually drained you emotionally?
Okay, bro, let me just see. So the patients on NG2, so I was assigned to be the patients. But I've not usually done the theory part of it, but I've already seen the staffs doing it, so I kind of wanted to give a try. Then I was okay, and I told the staff that I can do it. So I conducted the procedure very well. Then I didn't document. So while I was doing the procedure or performing the procedure, the patient's relative asked me, where is your record book? I kind of got a bit of confused, and I told her, Ma, I don't have. She said something that really got to me. I felt so emotional. I felt like, oh God, I fucked up. So it was really emotional, because for a patient's relative to ask me, where is my record book? I felt so bad.
Wow. So I want to know, actually, during that course of your experience, did you encounter anything that actually made you to feel like crying?
No.
Wow. Well, for me, actually, I encountered a lot of things, because there was a time I can remember vividly when a patient was angry at me that we should take the child. Actually, I work in the theater, so the patient that will finish operating, the relative were like, we should do fast and transport the patient to the ward. I was trying to tell the man to calm down. He nearly sparked me. It's just that God's grace held me that day. I did not fight back. I just told him, I said, sadly, you are a nurse. You are not a tout. So the experience is like that. So even if you do not get it now, you can still expect it in the future. So Nurse Monica, I haven't heard about this experience of emotional aspect. I believe a senior nurse or a matron might have one way or the other corrected you in public, and you know what I mean by that kind of correction. It sounds as if it's embarrassing. At that point, how did you manage the stress?
Well, the first time a senior nurse and even the matron shouted at me when I did something wrong at a point. It was embarrassing, yes, but I had no other option. I had to stay calm and stay obedient to them at some point. So I couldn't even take it anymore. But I swallowed everything inside, calmed down, then relaxed my mind and continued the processing.
Wow. That shows that indeed you are being called to be a nurse. So, they will at a time allow you to partake in a procedure. I want to know, was there any procedure that you partook in that actually got you scared of?
Yes, there was.
Okay, so can you tell us about it?
Okay. The first procedure I performed was vital signs procedure in female medical ward at APSUDS. So the procedure, I and my colleagues, we did the procedure, and it was very difficult. Even for the senior nurse there, it was difficult for her.
So what was the procedure that you did?
Just vital signs procedure.
Okay.
And this patient is a stroke patient.
Okay.
That when you go closer, you get injured by that patient. So when I went there to do my vitals, to check the BP was hard. Seriously, to check the pulse was hard. But at some point, I had to call one of my colleagues there to help me hold this woman so that I would be able to do it right. So when she was holding her, I had to get it.
Wow. That really tells us that when they said in nursing that every procedure requires 2 nurses procedure mostly, so you encounter that there are some things that you cannot do alone.
Yes.
You just have to be able to call another nurse to assist. Thank you for that. At least by now, even if you should encounter such a patient next time, you will know how to do better. Alright, Nurse Goodness, we want to know, can you share your most embarrassing moment at your clinical posting?
Okay. Okay, let's say I was on afternoon shifts on that very day. So I was supposed to resume by 2 actually. So I came to work around 3 o'clock. So me moving up to my moving close to my ward, I saw my chief matron. She kind of stopped me and said, "Are you a student nurse?" I said, "Yes, ma'am." She said, "And you're resuming duty by this time?" Her voice was so loud that it caught people's attention and they were looking at us. I literally felt like the ground should open. Let's the ground swallow me because
That kind of experience.
I don't. Jesus, it was really bad.
So at a point, we all got to experience that. Nursing is a standing procedure, something at most times you just be standing up and do your procedures. So I want to know, did you ever have any physical deformities or any physical challenge due to long standing hours?
A little bit, yes. That was when I was on afternoon shifts too, on a Friday in emergency ward. So I stood up for like from 2 to 7. That's 5 hours. I was standing throughout, and the nurses there would be like, "Don't sit down. You're not supposed to sit down. Nurses don't sit. Get your ass walking." That was what they said.
Wow.
So
This is a power actually.
So I stood up with my colleagues because we were walking throughout, and all of a sudden, as you are walking, your waist, this part, to start paining you. It was paining me. I reached home and I just had to lie down on my bed. I didn't even eat that. Seriously.
So you have encountered why nurses are always feeling tired whenever they come back from work. Is honestly, if I should call it, is a joyful thing. It is, but on the other way around, it can be frustrating. So, Nurse Goodness, I actually want to know, that in this nursing profession, while you are on your clinical posting, you'll be handling both your posting experience, you'll be handling the assignment that will be given to you, and you'll also be handling exams, because surely you will write exams after the posting. So how were you able to manage and cope up with these duties, exams, and assignments?
It was really a tough one because I'm not used to it, but I kind of make use of what you call time management. I kind of shared it, say from this hour to this hour I have to do the assignments, and from this hour to this hour I just have to focus on my books.
Wow. That was actually a nice time management. So, Nurse Monica, did you ever skip meal because of duty?
Every nurse skip meal. So I skipped like 2 days. Yes, that was when a patient that had DFU, and we were doing wound dressing. So after seeing that, I could not eat that day. I went home. I could not even touch anything. I could not even cook with my hands.
So what is this DFU that you mentioned? Can you explain to us?
Diabetic foot ulcer.
Alright. So after you could not eat well because of the DFU, I want to know actually, there is a relationship between the staff and the student nurse actually. So at a point, I believe they might have made you look as if you are invisible or undervalued. So can you tell us the experience? Did you actually feel that way in the ward?
Of course, I did. My second day, the second time I went for my clinical experience at Absolute. Honestly speaking, like, I don't know how to say. I don't even know what to say. Like, I felt invisible in front of my senior nurse and even the matron. It was like, hello, you don't exist.
Wow.
That kind of thing. So when they were going for a particular procedure, that was wound dressing. Next thing, the nurse was like, how when you call my honey?
Wow.
The thing got to me. And I told myself that from that moment, this woman must be less sick.
So that actually made you to losing your birth attachment.
Yes.
So you have to know more about it. So Nurse Goodness, I would like to know, can you share with us your most touching experience during the clinical posting?
Okay, it was at the female medical ward. A patient with peptic ulcer. She was in a lot of pain. She was shouting, screaming. So a senior staff assigned me to administer a medication on her that will help reduce the pain. So when I got to her, she was trying to express her feelings to me. She said the pain is too much. She wants to give up. That there is no need for the medications. I felt pity, but I kind of caution myself. I say nurses are not meant to sympathize. We are meant to empathize. So I kind of cancelled her, gave her reasons why she should take the medications, and also told her that everything was going to be fine.
Wow. Well, a valiant nurse indeed. So, Nurse Monica, I want to know, is there anything that clinical posting taught you?
Of course, yes. Clinical posting taught me a lot of things. It taught me about my coping experiences. It taught me how to interact more with my patients and even the staff nurses there at the matron. It also taught me the things that I'm good at and the things I need to work on.
Wow. So you learned time management and how to interact with the people. So Nurse Goodness, I would like to know, was there any skill that clinical posting made you to improve?
Yes, actually. It was a vital sign, especially while checking in blood pressure. This stethoscope indicating the sound of the systolic and diastolic. It was really confusing, a bit of confused. But after so much trials and all that, I kind of improved. Yeah, improved better.
So does it mean that clinical posting actually changed your life personally?
Yes, it changed me many ways. Things that I really don't know how to do. Like some procedures that I wasn't able to do. During the clinical posting, I kind of laid my hands on them and got used to them.
Wow. So Nurse Monica, I would like to know, this clinical posting, did it shape you into becoming a stronger person?
Yes, it did.
Wow, okay.
This kind of emotional person, like everybody knows that I'm an emotional type, but at some point I had this strong heart and strong mind. I had to follow most rules and regulations that the staff give, even though it's not what I want, even though it's not in my favor. I had to do them. So I got stronger in the process, even to a point where some patients had to leave, had to die. So I got strong because some of my colleagues there, some cried, some left, some did not even come for 2 days, but I kept coming there. So that's okay.
Okay, thank you, Abba. At least now you can now handle yourself or control yourself when you encounter a patient that just died. And despite we don't pray for that, but in case if you should encounter it, you can now handle it. But I would still want to know more, because I am interested in knowing these things. Actually, I believe there is one truth that students are afraid to say about clinical posting. Can you help the student to say it?
The particular thing that most students most nursing students are afraid of is performing last office. They are afraid of touching a dead body, talk more of seeing that dead body. So some of them, after performing that particular procedure, last office, some persons will not come to work again. They will not resume work again.
Wow.
Some persons might just fall sick all of a sudden. Because I had a colleague that performed last office and she wasn't able to come for her duty again. And it was because she fell sick after she performed that particular stuff.
Wow. So we should actually encourage nursing students that last office is also part of our work. So, Nurse Goodness, I would like to ask you this question. If you are to advise your younger self, like yourself now, on your first day that you went for clinical posting, what advice would you have given to yourself?
I felt being more observant, firstly, and more confident in myself, telling myself I can do it. The much trial will do better. Because looking back at it, I would say most of the procedures, it's not as if I cannot do it. I didn't have that confidence that I can do it. So I kind of regretted it after. I said, oh, if I knew, or if I had knew, I would have given it a try. At least I'll make mistakes and they'll correct me. At least I will have that experience that I've already laid my hands on such procedure.
Alright, thank you for these wonderful experiences that you guys have shared with us today. And I would like to tell us something that behind every successfulness that you are seeing today that is actively working was once a nervous studentness that was trying not to make mistake.
Yeah.
Please, audience, try as much as you can to encourage every student nurse that you see outside there. And in case this is your first time watching us, hit the subscription button, turn on the notification, like, comment. Thank you so much. I remain your honorable host, Nurse Ogo Salvation. Thank you for watching.